Welcome back to Body Beautiful. I'm Janelle Marie. We're just going to wrap it up now with Dr. Usha, and we get to talk about you a little bit. So let's talk about you and your practice. How long have you been in practice?
I've been in practice here in the Bay Area for over 20 years in private practice.
Okay.
Yeah.
And so what is your experience with Voluma?
I was one of the clinical trial investigators for Voluma.
Okay.
And I've been using Voluma for over 2 years, basically since it reached the market here in the U.S. And I'm also one of an instructor for Voluma, so I teach other doctors in the Bay Area, both dermatologists and plastic surgeons, how to actually inject Voluma.
Oh, that's wonderful. And I Hi, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Usha Rajagopal, and we're talking about a couple different procedures today. First up will be FemiLift, followed by Beautiful Eyes. Before we get started, remember, any advice we give you today, consult your own physician first. All right, let's jump right in. Dr. Usha, welcome. Thank you for joining me today.
Thank you.
Let's talk about FemiLift. I have not heard about FemiLift, so tell me what it is first.
FemiLift is an intravaginal laser resurfacing procedure that is now in the U.S. It has been approved by the FDA for the last year or so. We've had it in our practice for about 6 months.
All right, so then, first of all, laser resurfacing, how does it work?
The way it works is it's actually intravaginal, so it's actually placed internally into the vagina, and the internal vaginal mucosa is lasered.
So it tightens everything in there?
It tightens.
Okay.
There are three main things that the FemiLift does. First and foremost, it's really great for women who are having issues with dryness. So this could be slightly older women,
right?
Postmenopausal women, and that's a big issue. Second could be women who, for whatever reason, are on an anti-estrogen regimen. So after you've had breast cancer, sometimes one of the chemotherapy is an anti-estrogen, and that can produce side effects too.
Wow.
Or women for any other medical reason who've had their ovaries removed early, they can have issues.
So they're good candidates. Who else is a good candidate?
So that's one group of patients. The second group of patients are women who want a little tightening of their vaginal canal. So this could be also women who want tightening because they have mild urinary incontinence.
Oh, wow.
Or it could be women who just want to increase sexual satisfaction.
Or had babies, right?
Oh, so for a lot of these, so for women who had the mild urinary incontinence, it's usually women who've had intravaginal childbirth. So that happens. Or sometimes if you want just a little tighter. Yeah, you don't feel that there's that many, women with all those problems. You just think, oh, it's just after you have babies, but it can fix a lot of things that we didn't think about. It actually can. And
it's fantastic.
And I think as it's been in practice more and more, doctors are finding that it has even more uses than we've already encountered.
How long is the procedure? How long does it take? Yeah,
the procedure is we usually recommend 3 treatments, 1 month apart. And each time the treatment is less than 10 minutes.
Oh, that's wonderful.
And it's completely pain-free.
Oh, that's great.
Yeah.
And so what about downtime? Are there any side effects from that?
No downtime.
Good.
The only recommendation we have for women is not to use any products internally in the vagina. Okay. So that could be tampons or intercourse.
Okay. So just don't use anything.
For 3 days.
Gotcha. For 3 days.
That's it.
Okay. It's not too bad. What about cost? Is this expensive? You have to do 3, you said. So what would be the cost?
So the cost for 3 is $3,500.
Okay.
And for most women, they usually pay up front before they have the treatments done.
Oh, okay. Now, when women get their last treatment done, when do they see the benefits? Or is it right away?
They see the benefits even after the first treatment. Within about 10 days after the first treatment, they can notice benefits already.
Fantastic. That is great. And do you need less treatments, maybe if you're fixing incontinence, as to say after childbirth tightening, or do you always need the 3? You
need 3.
Okay.
And some people may need more in the future.
Oh, okay.
But certainly to start out, we usually say 3.
So if you still have a little bit, you can come back and get another one done.
Yes.
All right.
Not at all.
And then for FemiLift?
So FemiLift, again, is also done in the office.
Okay.
And there's no anesthesia required, and it is painless.
And do you need a ride for FemiLift?
No, you don't.
No. You know, we've all heard about labiaplasty. Do they combine it with that? Is that a separate thing? How does that work?
So the labiaplasty deals more with the external vaginal area, the pubic area, and so women sometimes do combine it. So if they have an issue with external labia minora, majora appearance or functionality of it, you can combine it.
Okay,
and
good.
It's very easy to do.
How common are these procedures? Like, how common now is labiaplasty?
With me, I have a niche with labiaplasties, and I probably do most in Northern California.
Okay.
So I'm going to say about 2 or 3 a week.
Oh, wow.
So I do a lot of labiaplasties.
Okay, good. And is labiaplasty just because they want the outers to look better, or there are other reasons to do labiaplasty?
It can be certainly appearance.
Okay.
And there's usually a component of the appearance of it, but a lot of women have functional issues. The labia minora can be a little too long, get in the way of clothing. So if they wear tight yoga pants, jeans, it pinches, tugs.
So that can be helped big time with that.
It can be helped completely.
Oh, that's wonderful. Labiaplasty, downtime, anesthesia. What's that?
So with labiaplasty procedures, I actually perform them in the office.
That's good.
With local anesthesia and a pill to relax you.
Wonderful.
So obviously you go home the same day, but you do need a ride home that day.
Do need a ride home.
And time off, I usually have them take 3 to 4 days off where they're resting and icing at home, and 3 weeks for return to all activities.
Gotcha. Not too bad, 3 weeks.
Not
all right, let's talk about beautiful eyes. Who are getting their eyes done?
You know, with eyes, it's all ages. It goes from women and men. Yeah, women and men in the 20s all the way to, you know, the 60s. Because eyes are really the attention of the whole face. I mean, it's, you know, when they say you look into someone's eyes, you look into their soul, so everyone wants to keep the eyes beautiful and young looking. So you can have someone in the 20s come in with either dark circles underneath the eyes, and that's genetics. It's not because of age or sun damage, it's usually genetics. And there are treatments for that.
Oh, that's good.
And women can come in and can start noticing some fine crow's feet around the eyes, and there are treatments for that. And if you start these treatments early on, you'll need less intervention later, and they look more rested and beautiful throughout the life.
And more natural.
And more natural.
Oh, that's good. And men, why are men coming in for eyes?
For eyes, same thing. Tired looking.
Okay. And non-surgical and surgical. So first let's talk surgical. Yes. What are we doing surgically with the eyes? So
most of the time when it's surgical intervention for the eyes, it's usually men and women who are a little bit older.
Okay.
So from their late 30s, usually 40s and 50s, when they have maybe excess fat pads in the lower lids, lots of excess skin, and then that's when we do the surgical eye lift or the blepharoplasty surgery.
Okay, and that's upper, lower eyelids?
Upper and lower.
Okay, and so a lot of people can get the skin flaps where it's hard to see, correct?
Yes.
Okay.
And if you wait long enough, and if you're genetically predisposed to it, you can actually have your skin flaps in the upper lids cover enough your eye that you have vision deficit.
Very dangerous. And what about non-surgical side? And this, I think, for what, more younger people?
Usually for younger people.
Okay.
And I think that is really growing by leaps and bounds.
Yes.
So like I was mentioning, it could be a young woman, a man in the 20s, and they're noticing fine crow's feet. You can come in and get a very low dose of Botox and prevent those crow's feet from actually getting any worse, and actually you can actually improve the way they appear, and you don't need a lot, and you need to come in very infrequently at that age.
So you think they don't need to go in their 20s, you got to wait till you're older, but you know that's good because then you don't have to do it all at once and you still have the movement in the face, right?
Exactly. If you'd asked me the same question 10 years ago, I would have said, oh, wait till you notice a crow's feet. But now what I've noticed is that the younger the patients are coming in, the less they need.
Okay, that's good to know. Let's take a look at some pictures, shall we?
Okay.
All right, picture number 1. What's going on?
So in this patient, she's a middle-aged woman, and for her, she has heaviness both in the upper and lower lids and some fat pads. So she's had just her upper and lower lids done. And you can see how she looks less tired.
Very much so.
She looks more vital, more active, less sleepy.
Yeah, definitely. In the after photo, I mean, you can really see the crease back in her eye, the upper eye.
Yes, and she still looks natural. So my goal is to make them look natural and less tired, and not to change the shape of her eyes. She's got beautiful eyes.
She does. Did you have to do anything else in that photo, like maybe a little Botox or filler with her?
In her, that's all we did.
Okay, that's great. Next photo.
So this is, again, a woman. This is a surgical correction. Again, if you look at her, both her under eyes and above eyes, it looks like she has full eyes and some bags, and here her eyes are more bright and beautiful.
Fantastic. That looks really good. Definitely you increase the crease on the upper.
Crease in the upper, and the bags in the lower are really gone.
What are the scars like on that and downtime for eye procedures?
So with the eye lift procedure, with the blepharoplasty, I also do that in the office.
Oh, perfect.
So you don't need to have done under general anesthesia.
Okay, good.
With local anesthesia and something by mouth to relax them. And so they need to ride home, but otherwise it's done in the office.
Fantastic.
And so this is a younger gentleman. And for him, it's a little more genetic. So he is maybe 30s, same thing, upper, lower lids. And so if you open it up, you can see how his beautiful blue eyes are.
Yeah,
they
very
really
nice.
open up, yeah.
Do you have to be a little more careful with the men, you know, so you don't open them up too much?
That's exactly right. So I think men need to be treated differently than women. In men, less is more.
Yes, absolutely.
Everything has to be done subtly, and they need to look manly. I mean, that's my vision of what a handsome man is. He needs to still look like a man and not like a woman. So that's really important to do everything with a light touch.
Absolutely. And scars go away in downtime?
So scars, so with the blepharoplasty surgery, the downtime is about 8 to 10 days where you're swollen and bruised, and scars fade for 6 months.
Okay.
And they're nearly invisible once they heal. So same thing again. In her, it was just the upper and lower lids that were done.
Yeah, that looks really good. I mean, very natural, too. And so when you are doing the upper and lowers, where are the scars? Because I can't tell where anything has been done.
In this patient, the upper lid scars are along her crease, so natural eyelid crease, and the lower lid is just beneath the lash line.
It's fantastic. I mean, that looks so good. You can't tell. All right, next picture.
So this is a patient that we were talking about when I said make more beautiful eyes.
Yeah.
And she's a very young, beautiful woman, but she didn't like the appearance of her eyes. Her eyes looked a little tired, maybe like she hadn't had sleep. So this correction on the right is not with surgery, it is just with fillers. Again, if you look at both the upper and lower lid, less hollowness,
you
brighter
got rid of
eyes,
the hollowness,
and this is done with
that's fantastic.
With the use of hyaluronic acid fillers, both in the upper and lower lid.
And one more for the same patient.
Same patient.
Oh, that's it. This is the last one. God, that is incredible that you just did that with fillers.
With just fillers.
Because she's pretty young, it looks like.
Yes, she's very young.
Fantastic. All right. Those are good. All right. Great photos. For more information about Dr. Rajagopal, you can call 415-392-3333 or check her out on the web, sfcosmeticsurgery.com. Great photos. We got lots more coming up. Hi, welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Usha Rajagopal, and we're talking about a bunch of different topics. We're also going to be posting the doctor's phone number in a minute, so get ready to write that down. Dr. Usha, let's talk about lasers and fillers, because I know we were talking about tightening of the skin. So I'm interested in that because a lot of people don't know that you can actually tighten maybe the facial skin, neck skin. Tell me about that.
So there are a couple of different ways to think about skin tightening. One is just skin resurfacing. That means lasers that you apply on top. They'll help with wrinkles. They'll help with fine lines. And that's the Fraxel laser, the CO2 laser. And those have been in the market for a while now.
All right.
The second way to think about it is tightening from the bottom up, from the inside on top. And I'm particularly thinking about Ulthera. Ulthera is a focused ultrasound, so it generates heat, and it heats up the deeper layers of the skin, so it improves the collagen production. So you actually get lift and tightening, especially of the jawline and the neck area. And it's also used for the décolleté area where you can get like the fine crisscross between in the cleavage, and it tightens all that.
The women have such problems with the neck area and cleavage area.
Yes.
It's usually red because, you know, of sun damage, and then it's just lined. That can help with that?
It can.
That's fantastic. And of course the neck, a lot of women will do something to their face, leave their neck out.
Yes.
But that's not good. So
there's no harmony between the face and neck, so you really want both to be done, yes.
All right, so if somebody wants to tighten up their face, their neck, maybe do a little décolleté, how do you say that?
Yes.
I said it wrong. What's the timeline on that? How long does that take?
So with the Ulthera, it's again an office procedure, and it's minimal downtime. You can have some swelling, and rarely you can have some bruising, but most people are back at work right away. And it takes about 90 days to notice full results.
And do you have to do more than once? You have to come back, or does it take care of it?
It's usually a one-time treatment. Again, if you have very severe problems with the neck, a lot of sagging skin, then you actually need surgery.
Yes.
But if things are starting to go the wrong way, then Ulthera helps.
Oh, that's wonderful. And can you get rid of maybe some sun damage on your chest area?
You can get rid of some of the sun damage on your chest area too.
Do you combine lasers and fillers? Is there anything you do where, you know, how do you do that?
So a great combination would be Ulthera along with a filler called Sculptra. That's a stimulatory filler. That means you inject it in, and it takes a couple of months to start working. Or you can do Ulthera and Voluma, or Ulthera and Juvederm, or Ulthera and Radia. So they're actually they go really well together, and they work synergistically. So they make both both things work better and last longer.
You're talking about Voluma, so let's take a look at some pictures.
Okay.
First one. What's going on?
So if you look at her, especially the cheek area and the smile line area, you see how everything's lifted up? There's less shadows. So with Voluma, what I like is she still looks very natural, but she looks rejuvenated, looks more vital, but doesn't look like she's had anything done.
Not at all. So you just filled in the parts that were a little hollow?
Yes. So it's basically the cheek.
Cheek.
In both sides, and it lifts up.
Oh,
so when you inject the cheek, it actually lifts up the smile lines.
All right, so how long did that take?
Something like that would take about a 30 to 40 minute office visit.
And any anesthesia on that one, or?
Just topical anesthesia.
Okay.
We put some numbing cream, and that's it.
That's fantastic. Oh,
so
this
same
looks
thing.
Good.
So here, again, it's on the cheeks. So
what do you need maybe just to kind of get that lift?
About 2 syringes of Voluma.
Okay, and one time, and does Voluma stay, how long does Voluma last?
So I usually tell my patients it'll last a year before you need a touch-up.
That's good.
But if you look at the FDA data, the FDA says it lasts 2 years. But really, if you wait 2 years, it's all gone. So usually you should come back in a year for a touch-up.
Come back for some little touch-up. And look, you didn't even fill those lines. They just lifted right on up.
They lift it up. Because the skin is thin enough, it lifts it up.
Do you need a ride on these?
No, you don't.
Okay, good. So you can go get them done in the office. And look at this.
Same thing, especially if you look at that, that oblique view, you can see how everything looks lifted. She looks like herself, but she just looks a little better.
Yeah, just definitely less tired, and you don't see those shadows as much anymore.
You don't see the shadows, and she looks better, and she doesn't look like she's had anything done.
Not at all.
There's no telltale sign of having anything done.
A lot of people are overdoing the cheek area right now.
That's very true.
Seems to be in.
So it really, you need to look at the whole face and really have the entire face blend together. So you just can't have the very full cheeks like you see in some of the reality TV shows and ignore the chin or the jaw.
No, not at all.
All the areas need to be done
Then it looks
correctly.
lopsided.
It looks very lopsided. Same thing. And then there's a picture that shows the cheek in the side view.
Oh, yeah.
So that's called the OG, or the gentle curve.
Okay.
It gives you that curve because as you get older, the cheek flattens.
The curve, yeah. But then you've got to do it, just perfectly so you don't get the over curve.
Exactly.
I mean, that's
so
really
you would do Voluma to the upper cheeks and another sort of filler, if they need, to the lower part of the cheek. So using like a Juvederm or something around the chin area or a Radiesse works really well.
And so cost-wise, and I know you don't really want to say the cost, but does it vary? Is there a range?
Yeah, usually Voluma costs a little bit more than Juvederm or Restylane, but also lasts a little bit longer.
Longer. That's the key. Last photo here.
Again, her, you can see, so it's in all races. Everyone looks better. You don't need to be one kind of skin type or one kind of facial feature, but everything looks good. We do so many fillers that our costs are very competitive.
Oh,
very,
good.
Very competitive, yes.
Okay, good. That's good to know. And you didn't do anything with the eyebrows there? It's just all...
It's all fillers.
Just cheek. That's fantastic. I like that. It looks really good because, just very natural and not tired anymore. All right, great stuff. All right, for more information about Dr. Raja Gopal, you can call 415-392-3333 or check out her website, and they can see all the pictures there, right?
Yes.
All right, sfcosmeticsurgery.com. We'll be right back with transgender. You have a specialty, transgender surgeries, non-surgical and surgical? That's fascinating.
Certainly, in the last few years, I've noticed an increased trend in transgenders coming in to have surgical and non-surgical procedures. Obviously, with the surgical procedure, since I'm a plastic surgeon, I deal mostly with the male to female or female to male chest surgery or body contouring surgery.
Okay.
Having breast implants or sometimes making a chest more manly or liposuction. And sometimes if they have enough fat, we can actually give them more hips by putting fat in or giving them a cuter bottom. So we can shape the body with their own body's tissue, like fat. The other area that's really taken off is also feminizing the face or masculinizing the face with fillers.
Wow.
And that can be done very well in the office with very minimal downtime.
We have a picture, actually.
Okay.
One of those transgender procedures. What happened?
So this patient actually was a female to male transgender.
Wow.
And she's had breast implants and a little bit of body contouring. You can see how her tummy looks a little more feminine and certainly...
And the hips. The hips look, Oh, that's fantastic. And so, who's coming in for this? A lot of people? I mean, Bruce Jenner's in the news now. This is really on everybody's mind.
And I think that's made more people more confident about coming.
Now, you talked about masculinizing the face. I didn't even know that you could do that. What do you do?
So I do have a lot of male patients who come in, even when they're younger, who just want to look better, and certainly when they're older, they want to look a little more young and more vital.
Yeah.
So I think doing fillers and Botox in men is very different than dealing with women. You have to approach them differently because you want a man to look like a man after everything's done.
Absolutely.
So same thing. So in men, less is more. So less Botox. You do want more movement in men. You don't want a frozen face. You don't want eyebrows that are very high. And same thing with fillers. You want a man to look like a man. You can't give them full fat cheeks or fat lips that doesn't look like a man. You want them to have strong bone structures, so those high, strong cheekbones, nice strong jawline, a nice full temple. So really you have to treat them very differently.
Fascinating. Never even knew that was possible, that you can masculinize the face.
And I love treating my male patients. They're very thankful.
All right, you do it all. Thank you so much. But unfortunately, we are out of time. I could talk about this all day. Thank you so much for joining me, Dr. Usha. For more information about Dr. Usha, you can call 415-392-3333, or you can check out her website, sfcosmeticsurgery.com. And on that website, you can see all those pictures, right?
Yes.
All right, so thank you for joining us. Thank you for joining us on Body Beautiful.